Hi, my name is Heather Bear. I will be doing your training today. This training will cover strategies that will help with skill acquisition and behavior reduction. Some of the breakdown of this training will include going through the intervention steps and procedures, um, checking in on RBT response and consequence training. We will view some prompting strategies and discuss assent withdrawal along with trauma informed care. And then last, we will touch on diversity, equality, and inclusion. For this intervention, we will be looking at the skill acquisition of requesting a break in order to utilize a replacement behavior while looking at behavior reduction. So the target behavior would be Sam independently exchanging a break picture with a communication partner in order to appropriately request a break. This target behavior would be the skill acquisition that we're targeting in order to reduce his maladaptive behaviors such as screaming, flopping, aggression, and elopement. This teaching procedure would look like setting up the environment so that Sam is able to communicate and gain access to a break. In order to do this, we will put the break icon on the desk in front of his textbook and place the book directly next to him. The reinforcement procedure for this skill acquisition would be verbal praise, provided with immediate access to escaping the undesired activity when he appropriately requests for a break. The strategy for this intervention would be that the target behaviors typically occur about 1 minute after table time begins. So the strategy would be that you are prompting or ready to prompt the break icon before 1 minute occurs when we typically see those maladaptive behaviors. This way, you're able to ensure that he has access to appropriately request for a break before engaging in these precursors or target behaviors that we will look at in the next slide. For the setting event of when this typically occurs and when we should be implementing this intervention would be while he's seated at his desk during table time. Now we're going to look at what your response should be as the RBT when you're seeing precursor signs and when you're seeing the target behaviors that are targeted for reduction. So any of these physical or behavioral signs that may be precursors to those behaviors that are targeted for reduction would be screaming, flopping, and knocking objects off the table. If any of these precursor behaviors occur, you should utilize prompting procedures so that he can gain access to a break before escalating to these dangerous maladaptive behaviors that we are trying to reduce. Now, when looking at the target behaviors, these are the target behaviors for reduction. These are aggression and elopement. These are potentially dangerous behaviors, so you should utilize blocking and de-escalation strategies. Next, we'll be going into some prompting strategies. I added a visual here of the prompting hierarchy. So you can see that we would start off with a visual prompt. This includes positional prompts. So when utilizing prompting for requesting for a break, a visual prompt could be used by putting the break card closer to Sam. You can also use a verbal prompt. This includes direct and indirect verbal prompts. And this would just look like verbally prompting him that he can request for a break appropriately. We can also utilize gestural prompts, which would look like pointing or gesturing to his break card on his desk. The model prompt would be touching or picking up the break card to model giving it to his staff. Then we go into the physical prompts, which are partial physical prompts and full physical prompts. We will go a little bit more into this in the next slide. We were going to touch a little bit on trauma-informed care. When utilizing physical prompts, it is important to keep this in mind. And we want to look at assent and assent withdrawal when using physical prompts. So we never know what clients may have experienced trauma in the past, and this can be really important when utilizing these physical prompts. So first, you should be asking or telling your client before we're implementing any physical prompts and touching any clients. Two, if the client pulls away or resists, then we must honor this action and let go. We will not be physically restraining any clients or holding any clients if they are resisting and pulling away. Three, no procedures involving restraints or holds should be implemented without reviewing the crisis plan that a parent has signed off on. Sam does not have a crisis plan, and he does not have any restraints in his behavior support plan, so there should be no holding or restraining him. Four, at times when a client is withdrawing assent, cannot be honored, you should ask for BCBA's assistance. With elopement, this can be a dangerous behavior, but you need to utilize blocking strategies, not holding Sam's body. This also goes for pulling on his clothing, his pants, shirt, grabbing by his arms or his wrists or other body parts, or when prompting to stand up, or picking clients up when they're tantruming, crying, protesting. Refrain from doing so until he is calm back in HRE. If there is an unsafe situation, please call for assistance. Again, we need to utilize antecedent strategies such as blocking and not holding the client. Next, it's just important that we touch on diversity, equality, and inclusion in all of our trainings. When we're utilizing DEI, this results in decreased inefficiency, increased patient safety, improved outcomes, and increased patient satisfaction. So it's important when we're considering this that we think about language, religion, education, and socioeconomic status. I hope this training was helpful. Thank you.